My name is Stacy Brown, and I am the Rural Health Clinic Medical Director at Northern Inyo Healthcare District. I've been in town for 22 years treating the members of the community, and this is another honor for me to be able to do this during this pandemic. If you think you need to be tested because you have symptoms or you're a healthcare worker, you want to contact your primary care provider. They can end up contacting the district through the rural health clinic or the emergency room to see if you require testing. Everyone wants to know if they have COVID, but at this point we should expect that if you have symptoms, you probably have COVID and you don't need to be retested. So regardless of whether you have a positive test or not, you should be doing the same type of protective things that we do normally in an epidemic. Those kinds of things are hand washing and social distancing. When we first realized that COVID-19 was in the United States and coming towards the Eastern Sierra, we decided to take some steps to try to get ahead of the curve. So right now we have good capacity to handle the patients that are getting sick from COVID. The respiratory symptoms are obviously the worst, so having enough oxygen and respiratory techs, enough equipment, enough medicines to handle the pneumonias that happen. This also includes a number of ventilators in case we need those. I know that's always on people's minds. But we have enough capacity at this time to be able to treat the patients that we have coming in now. We don't know what happens when the surge ends up happening where there's a lot more patients, and part of the reason to continue doing the social distancing and the protective things like wearing a mask when you're outside is to really reduce the amount of load on the hospital. At some point, we may get to the stage in this disease process in the community where we're going to start running low on supplies. And these could be things like fabric gowns or masks or face shields, but it also may be some essential services that we've been delivering for a lot of years, and it's going to be hard to deliver those kind of services in the future. This could be something as serious as not being able to respond to a car accident or a fracture or an appendicitis. If we do our job now and do our social isolation and be able to extend our healthcare services, we're going to be able to help those patients when they really need us. The things that you can do to help support the medical community are pretty varied. They can be as simple as sewing a mask at home or reinforcing a message for social distancing. That means staying at home. That means not going out to socialize. That means not having people come in to socialize. That's going to be our first line of defense. This kind of isolation and this kind of control of contacts is really going to be how we end up beating this thing. For more information, you can look at our website, www.nih.org, and click on the COVID banner. This includes some press releases from the hospital, as well as an operational status. Stay healthy and stay home.